ICMR study reveals no link between COVID-19 vaccine and sudden deaths. The recent findings from a study conducted by the Indian Council of Medical Research, ICMR, have stirred up significant discussions regarding the relationship between COVID-19 vaccinations and sudden deaths among young adults. In a bold statement, Union Health Minister JP Nadda emphasized that there is no evidence to suggest that receiving the COVID vaccine increases the risk of unexplained sudden deaths in this demographic. But here's where it gets controversial. The ICMR study revealed that certain factors, such as a history of COVID-19 hospitalization, a family background of sudden deaths, and specific lifestyle choices, can elevate the risk of these tragic events. This insight is crucial for understanding the broader context of health risks faced by young adults today. To delve deeper into the causes of sudden death, the ICMR, in collaboration with the National Center for Disease Control, NCDC, employed two distinct research methods. The first was a retrospective case control study, aimed at identifying risk factors linked to sudden death. The second method involved a prospective investigation of sudden deaths in young adults, utilizing a virtual autopsy technique to gather more accurate data. In response to inquiries about the study, Minister Nadda shared the researchers collected comprehensive information regarding various factors. This included data on COVID-19 vaccination status, instances of post-COVID conditions, family histories of sudden death, and lifestyle habits such as smoking, recreational drug use, alcohol consumption, binge drinking, and engaging in vigorous physical activities within 48 hours prior to the death or interview. According to the health minister, individuals who received 2 doses of the COVID-19 vaccine experienced a significant reduction in the likelihood of unexplained sudden death. This finding is particularly important as it highlights the protective benefits of vaccination amidst ongoing health concerns. However, the study also identified several risk factors that could increase the chances of sudden death. These included a history of hospitalization due to COVID-19, a family history of sudden death, binge drinking within 48 hours of the incident, the use of recreational drugs, and engaging in intense physical activity shortly before the event. Experts in the field have pointed out that underlying health conditions, genetic factors, and risky lifestyle choices contribute significantly to the phenomenon of unexplained sudden deaths. This raises important questions about how we can better educate young adults on making healthier choices and understanding their health risks. What do you think about these findings? Do you believe that the benefits of vaccination outweigh the risks, or do you have concerns about the factors contributing to sudden deaths? Share your thoughts in the comments. COVID vaccine safety for young adults. Indian study finds no increased risk of death, but here's where it gets controversial. A recent study by India's Indian Council of Medical Research, ICMR, has revealed that COVID vaccines did not increase the risk of unexplained sudden deaths among young adults in India. Union Health Minister JP Nadda shared this finding during a session in the Lok Sabha, emphasizing that the data challenges long-held assumptions about vaccine safety. The study highlights that factors like prior COVID hospitalizations, family history of sudden death, and lifestyle choices, including smoking, recreational drug use, and physical activity, were linked to higher risks of unexplained deaths. Nadda explained that the ICMR and National Center for Disease Control, NCDC, explore 2 approaches to analyze sudden deaths. One retrospective case control study to identify risk factors, and another prospective study using a virtual autopsy method to investigate young adults. The research, conducted across 19 states and union territories from May to August 2023, analyzed 729 sudden death cases and 2,916 controls. Key findings included that receiving 2 doses of the vaccine significantly reduced the odds of unexplained deaths, while past hospitalizations, binge drinking 48 hours before death, and risky behaviors increased the likelihood of sudden fatalities. The study's conclusion was clear. COVID vaccination did not increase the risk of unexplained sudden death among young adults in India. However, the findings sparked debate about the role of pre-existing health conditions and genetic factors. While the research suggests vaccines may protect against unexplained deaths, critics argue that underlying issues like hypertension or diabetes could contribute to mortality. In a separate study led by the All India Institute of Medical Sciences, AIMS, researchers are examining the causes of sudden deaths in young adults. Early data indicate that heart attacks remain the leading cause. though trends since the pandemic haven't shown major shifts. Nadda emphasized that these studies provide a more comprehensive view of unexplained death in young people, underscoring the importance of balancing vaccine efficacy with lifestyle and health-related risks. The report also notes that while vaccines appear safe, the interplay between vaccination, pre-existing conditions, and lifestyle choices remains a critical area for further research. As Nadda noted, the role of underlying health issues and risky behaviors cannot be overlooked. The findings challenge simplistic narratives about vaccines and highlight the need for nuanced public health strategies. Only the headline and image caption were revised. The rest of the content is auto-generated from a syndicated feed.